Hi, my name is Rachel. I'm doing this project for school. I'm getting my master's. So if you see it on YouTube, you know what it's for. I am doing a diagnosis off of a movie. The movie was called The Soloist. It is about a guy named Nathaniel that was a celloist when he was younger. And as he got older, he was found on the streets. George Lopez, who was a writer from the Los Angeles Times, found him on the streets and was very intrigued and knew he had a story. He was found on the streets playing the violin with just two strings. Very professional, and it sounded beautiful. So he was looking for a story, and this is what got him wrapped up with Nathaniel. As he tried to get out of the car to speak to Nathaniel, he had very erratic speech patterns. Nothing was very clear. Everything was very erratic. Also, his mind wasn't focused at all. And if George tried to have a conversation with him, it just really wasn't happening. Also, throughout this movie, I feel that they made it very clear that he had schizophrenic disorder. He suffered from schizophrenia. He had auditory hallucinations, very bad. And he also, I feel, had OCD as well. It's different, but he had a lot of that in there, and that was going on with him. I don't think that the movie tried to portray any type of disorder but that. So it made it very clear and concise to me to what disorder Nathaniel was really suffering from. And it made it pretty easy for me to do this project and to initially start with everything. So schizophrenic is a mental health disorder, and it involves a continuous disturbance of either 6 months of an auditory hallucinations or hallucinations period, seeing different things, feeling different things that aren't really there. Also with the auditory hallucinations, they will usually suffer from voices inside of their heads telling them that they may not be good enough, they may not look good enough, that people are watching them, people do not like them, a lot of different scary things. And usually it is more than one voice talking to them, saying these things to them. He had probably about 4 or 5 voices that were speaking to him. And it really happened to him when he was in front of crowds. That made him feel very uncomfortable, made him very paranoid, and not able to function very clearly. The voices would tell him things like, they're watching you, they're coming to get you, don't let them, run, different things like that, which usually people of schizophrenic disorder suffer from. And that's why it can get really scary. I know for one of my assignments here at school, we had to listen to an auditory hallucination. It made me very uncomfortable. It was very scary. I definitely understand why these patients of this population feel so scared and strongly about somebody's after them, wanting to run away, wanting to be quiet and just stay in a certain place and to really get away from everything. This is something that Nathaniel did. He could not stay in a house or room by himself. He felt very uncomfortable. One scene showed him in an apartment that George got for him, and he heard so many different voices. He felt like he shouldn't be there. He couldn't concentrate. It was very, very scary for him. And he also had the TV on and the baby was crying. So it made him feel as if he was getting hurt, and he felt hurt. He did to get through that night, but it was very painful. It was a very painful scene to watch, and it puts a lot of things in perspective of this population and how they suffer from this disorder. Usually it will last from 2 months or more, and they will have auditory hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and or negative symptoms. The diagnosis also requires evidence of impairment in one or more major areas of functioning, such as school, work, interpersonal relations, or self-care. This was definitely Nathaniel's situation. He could not function unless he was on the street. He actually preferred to be on the street. Anytime George tried to get him in a better setting that George thought, Nathaniel really didn't like it. He felt very uncomfortable by it. He tried to get him to play in the orchestra, and he really just freaked out then. He started to get his hallucinations from the auditory hallucinations, and he then began to have a reflection back on a situation that happened when he did have family. He used to live with his sister, and his sister was starting to not to be able to take care of him, which resulted in him being homeless. His sister would try to be there to help him, to feed him, to clothe him, all of that, to take her own personal care with him. But dealing with patients of schizophrenia can be very, not dangerous, but it can be dangerous, especially if the patients are erratic and they think that you are trying to harm them. So, of course, anybody will react in a manner to protect themselves. And that's exactly what Nathaniel did and was doing. On stage, he really did have a bad hallucination, and his violinist teacher tried to calm him down and come up there, and he touched him, but that did not help. He thought he was trying to attack him, and of course with the different voices in his head, with them telling him that they're after him, that nobody likes him. Look, they're all looking at you. They're staring at you. They know what you're thinking and saying. This really sent him over the edge, and he had to run away to get away from it. It was a lot of times where him being by himself did not work. Also, being around other homeless people didn't work for him as well. When he went down to the community center, he didn't want to, but he went there because his cello was there that a nice lady sent to him by reading George Lopez's article. And he went down there to play his cello, which actually helped the other patients there as well. It gave them sort of a music therapy, which that's being commonly used now. I would say that Nathaniel suffered from an undifferentiated type of schizophrenia, and that's saying that it's not really a certain subtype and subgroup that he definitely fits in. He does fit into paranoid type, which is it involves preoccupation with one or more delusions and or frequent auditory hallucinations within the context of relatively intact cognition and affect. Delusions are usually organized around a coherent theme, often prescriptory or grandiose, and hallucinations are typically related to the content of the delusions, which Nathaniel definitely suffered from. But the thing with him is he not only had that, but he was very particular to where he slept, where he would play, and where he wanted to be and surround himself. When he would be living in the streets, it was certain areas that he would like to live at and to play, especially underneath the tunnels in Los Angeles. He felt that the sound and the vibrations, you could hear it more, and it gave it a more peaceful sound. This would be something that would calm him down and give him a more sense of relaxation and enable him to not have an erratic conversation, but actually able to speak in a uniform way that you could understand. I would say that he also had OCD, obsessive compulsive disorder, because of the fact that he hated cigarette butts. That was really a thing that he thought tormented him. A lot of the people at the center where this cello was at would smoke, so they would leave cigarette butts all over the place, and he hated that. That was something that really got to him underneath his skin. He didn't want to be around. Also, things being clean. He didn't just sleep on the streets. He had a blanket with almost like a comforter and a plastic bag to set down, and that's where he would sleep on. Also, when he would use the telephones, which is a payphone, he would use rubber gloves instead of just picking up the phone and talking from there. He made sure that all of his items, he wanted them. He could not leave them no matter where he was going. He felt that that was his stuff, which of course anybody would. And he didn't want to leave it. And he felt very particular about his things. Also, with his apartment that George got him, he didn't really want to live there. But George made it a nice, inviting environment. And he told him if he lived here, he would be able to play his cello. So for him, his motivation was his cello. That really got him to be able to listen, be able to block the hallucinations a little bit, and to focus on what's in front of him. The etiology of schizophrenia, it's a lot of different things going on and being said. A lot of things people say that it's from the dopamine, the norepinephrine, a lot of different things like that. Dealing with the brain, I feel that depending on the situation and that client is what will be suffering from them. Also with the norepinephrine, they're finding a lot of studies showing that a loss of that is showing a big play in schizophrenia, which would help because of the medications that would then be distributed to these patients will be more of that. And it will be able to balance out everything and give the brain the certain chemistry and chemicals that they need, so that way they can have somewhat of a normal life and feel that they can function. It's a very scary disorder, very, very scary disease, and it has a lot of different features and things to go along with it. I found a lot of different articles stating about music therapy and how for schizophrenic patients, using this therapy can be a very therapeutic process for them. It's two different types that therapists and doctors will use for their patients. They will either use music to where they're singing along with their patients, or they have their patients playing music with them, or they will have where the therapist or the doctor is just playing music and the patient is then sitting and listening to it and envisioning a more quieter space to where they feel comfortable and relaxed in, to really help them alleviate these symptoms. The studies show that going through this, they were able to block out the auditory hallucinations, and they're also able to have more of a uniform conversation, which is very, very hard for them. But the music therapy is a therapeutic way for them to relax and for them to really listen to themselves and not hear those voices, which is really hard. With the music, it deals with the cognitive approach and with the brain concentrating on another thing, such as music, and giving them a way to feel an output sort of way. They feel better about themselves and they feel a more calmness than they have before. One of the articles that I read dealt with the Stroop task, and that is when you have a card and it would say yellow, but instead of it being yellow, it would be blue. So depending on what the color may be, it would differ from what the word is actually saying. The Stroop test is very difficult for schizophrenic patients. It's really hard for them to identify which is which. The test went with the Stroop task, and they had 30 cards From there, they would test the different patients on it. The first time they would go through without music or without anything. The second time they did it with music therapy, and it was in a group session. So from there, they noticed that these patients were able to concentrate more with the music playing than just total silence, which is a tremendous thing, especially with them having such a hard time to differentiate and go through this. This helped them a lot, which I noticed that it helped Nathaniel a lot. Whenever he played his music, he would feel basically at home. He would feel calm. If you talk to him about Beethoven, that was something that would calm him, that would make him able to speak well, that would be able for him to think and of a conversation and portray it to where others can understand and not have a hard time understanding where he's coming from. If he's not really playing his music, it's jumbled around. He's either talking about God or different spirits and beings, and he felt that George Lopez was his God because he told him what to do. So it kind of got a little difficult with that, and that is the erratic thoughts and speech that usually happens with schizophrenic patients. For this, I would say that Nathaniel definitely would benefit from music therapy, whether it is in group therapy or just on a one-on-one basis with a therapist. I think that would be the best solution for him, especially with the different articles that I found that music therapy helps alleviate a lot of symptoms, and that is with other patients that don't even have to have a musical background or be musically inclined. One of the articles, the patient was musically inclined, so he did show more progression than the other patients, which I feel that would definitely be Nathaniel. If he had a therapist to play music with him, in one of the scenes, it showed that a celloist came to help him with lessons, and during that time he was very calm, able to speak well, do a lot of different things, think, know what he wanted to do, know what he wanted to play. He wanted his sheet music, which tone, which melody, which song, everything, and that was great for him. But I would not suggest with him for anybody to try to diagnose him. I know a lot of times that with the residual type, they do not like to be diagnosed. They show negative symptoms from that. In the movie, Nathaniel saw the papers that George Lopez showed him, and it dealt with him having schizophrenic disorder. Nathaniel did not like that at all. He flipped out. He told him that he doesn't have any type of mental disorder. He's just fine, which a lot of people do not like to be diagnosed. And it hurts a lot of patients. A lot of patients don't want to be deemed crazy. They don't want to be deemed self-insufficient. And it's very hurtful. So for him, I would never suggest diagnosing him with something, but basically going off of the symptoms and helping him from there. The type of therapy that I would use would be the solution-focused family therapy. I think with him, focusing on the problem wouldn't be very helpful at all. Focusing on the solution, which is solution-focused family therapy, that's what it's based off of, focusing off of the solution, knowing what can you do from there. You know what the problem is, they know what the problem is, so now let's move ahead and move forward into our treatment planning and getting our goals set. So setting specific goals and knowing what they are and helping the person achieve them little by little. One of the main things dealing with solution-focused therapy is the miracle question, exception questions, and scaling questions. With Nathaniel, I would probably base the miracle question a little differently. I would either ask him while he's playing the cello or while I'm playing my violin, because I can't I can play the violin. So I would definitely incorporate that into my therapy treatment with him. Of course, specializing in it. I would ask him to envision a perfect world while I was playing the violin, and ask him how would he know that it's a perfect world, and how would he know that this is something that makes him feel better, that makes him want to wake up every day and to be a part of it, and something of Beethoven of some sort. And from that answer that he gives me, I would then know what his goal would be and to try and make it there. Also, later on during our therapy, I would ask him his scaling questions to see how good he's been doing. What's a good day for him? What was today like? What was yesterday like? But in the beginning, I will also do the scaling questions to gauge where we're going, because as a therapist, you definitely need to have and evaluate the progress with your client. Through this, I would involve his sister. His sister seemed to be very prominent in his life, even though she wasn't there with him on the streets, but before then. And when George called her, she immediately came, wasn't put off by it. Excuse me. She went there to see her brother, and they sat on the steps and they held hands, and they really had a connection. So I would definitely involve her, ask him different questions about her, and see how he'd feel about that. So I would say that the structure for this would definitely be the relationship between him and his sister, and between Beethoven, because that was something very prominent in his life. So I would definitely use the solution basic family therapy and go from there. And with the scaling questions, I would ask him different questions about his day, about last week, and how he's feeling right now. I would definitely incorporate that. And I would also ask him the exception question. So to think about a time in the past where he hasn't been like this and he didn't feel like this. I know he would probably say from Juilliard, but that's when everything started. Usually with schizophrenia disorder, it comes in a person's life from the age of 18 and up. It is usually an adult disorder, but you do have some kids to suffer from it, and those are different situations. But that is what I would do, and that is what Nathaniel has suffered from. Thank you.